ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Welcome to the session exclusive for Pranasakhi community. Allergies is very common known word for everyone. It can be as simple as a skin rash to a fatal one. Everybody knows their trigger factor, they know how to manage it, but at the same time they are scared because few things which I was comfortable few years back is troubling me now. How to go about this? This reminds me a story of a king, Raja Parikshita. You all might be knowing, the grandson of Arjuna, son of Veera Abhimanyu. He did a prank and he was cursed that he will die out of a snake bite. What did he do for that? Allergy or a venom. So to stay away from that, he built a castle so that never a snake comes into his castle. But could he do it foolproof? Most of you know the story how the snake entered his castle in a form of a fly entering a fruit. Similarly, we know the allergens. We know we have a protocol with us. We have a lot of prophylactic things. We have done the test. We are careful about our food. But still, it troubles us. There are so many things to know about these allergies and why one particular person is having a challenge with that particular kind of food or substance. Why not everyone? So to know more about this allergy and around it, we have an expert with us. To introduce her, I request our founder director, Dr. Sandhya Ravi, to take over the session to introduce her and the topic as well. Over to you, ma'am.
Thank you. Thank you, Manasa. Good evening, everyone. Welcome, Dr. Sujata. It's a pleasure to have you here with us today. We are really looking forward to, and so are so many of our members of the Pranasakhi group, because this is something, especially for people who are staying in Bangalore, almost every second person says they have some kind of an allergy. So it's a much awaited topic that people want to hear about. And who better than Dr. Sujata, who is here with us today to share her knowledge and expertise. Sujata and I go back many, many years, right up to medical school in the 70s. So we've been students at the Stanley Medical College, and today she's a highly respected consultant in allergy and immunology at the Columbia Asia Group since 2007. And she serves as a consultant in allergy immunology now at Manipal, Yashwantpur, Hebal, and Yelahanka. She was, after her graduation in Stanley, she moved to the US, and she is a diplomate of the American Board of Allergy and Immunology and the American Board of Pediatrics. She's a Fulbright Scholar recipient, and she worked for many years in the Department of Pediatrics at the State University of New York in Buffalo as Clinical Associate Professor of Pediatrics. She graduated with honors her initial childhood from the Lawrence School, Lovedale in Ooty. She was awarded the President's Medal and received the National Science Talent Scholarship from the Government of India. She has many, many awards and honors to her credit, a lot of them in the area of allergy, food allergy anaphylaxis. She was given the Mariel Furlong Award in New York and the Perry Award by the American Lung Association, many, many awards. And of course, the best outgoing pediatric resident at the Children's Hospital of Buffalo. She has received many grants, research grants in the area of research from the CDC, that is Center for Disease Control in the USA, to work on allergy, asthma, and immunology. Of course, she's been invited for hundreds of lectures and has a lot of publications and presentations in a lot of peer-reviewed journals. She was also the president of Buffalo Allergy Society and a member of the New York State Asthma Guidelines Committee. So for the last 20 odd years, she's been on and off in India and the US, and has been working very, very sincerely in this field to bring in the importance of allergy immunology in various hospitals. So who better than Dr. Sujata to help us understand this topic better today. Over to you, Sujata.
Okay, thank you so very, very much. It's a great pleasure to be here. And I know Dr. Sandhya and her organization has done some phenomenal work in terms of preventive healthcare, education, awareness, and I cannot say enough because I send a lot of patients to Dr. Sandhya, and the attention she pays to analyzing and giving patients a solution. It is something truly remarkable. So it's wonderful to be here. And I've had some glitches in sending the email and sending the slides. So somehow I hope we can manage. But I think I'll take it as an opportunity to keep it more interact. And if something doesn't work in terms of what I want to say in sequence, we can kind of take a break and go on to the discussions. So please go ahead and project the slides. Okay. So what I want to talk to you about is this whole spectrum as asthma, allergies, and I would not even call it food allergies so much as food sensitivity, because these are a lot of issues, and I know all of you have sent many, many questions regarding this. So you can go to the first slide, please. Okay. So when I ask patients what are allergies, they say, "Oh, I'm seeing you, I have allergies." So what do you mean by allergies? Is it nasal, with sneezing, stuffy nose, runny nose, the allergic rhinitis? Is it wheezing, cough, asthma, affecting your respiratory system, your lungs? Or is it food allergies? And that's a whole topic. Is it something that you eat that bothers you? Does it cause a rash, itch, or swelling, which is the urticaria angioedema? Or do you have eczema, atopic dermatitis, dryness, irritation, contact sensitivity to some allergen that you think something may have caused it? Or do you have a lot of gastrointestinal symptoms like indigestion, bloating, something doesn't agree with you, you feel the food is causing these issues? So it means a whole lot of things, and I will show you in the next slide. So the tendency to develop allergies is called atopy. And I will show you in the next slide that it's a little bit a mix and match of a lot of things. So you could either have food allergies, which is more common in infants, or you could have the eczema, which you've seen in quite a few infants, and that's related to food allergies for the most part when it's in infancy and young child, less than 5 years of age. Not likely to be due to food in older patients. There's different reasons for why you get the dermatitis or the eczema or the skin issues in adults. Asthma is something very common. And allergic rhinitis, the nasal allergy, is probably the commonest of all the allergic manifestations that we see. You can have a little bit of this, a little bit of that, or exclusively one or the other. And we will focus on the commonest, which is in the next slide. Okay. So I really don't have to say more about what this patient has. You can all understand what the problems are. Okay, so that's the sneezing. And I wonder what kind of an argument they are having, and what language is being exchanged between the two. Very irritated and a lot of symptoms. So we can hit the next button, please. Okay, so we talk about nasal symptoms with sneezing and itchy nose, stuffiness, congestions. People often come and tell me that my sinuses are acting up. Oh, my sinus headaches. I'm so irritable. I can't sleep properly. I can't focus. I can't concentrate. It's really bothering me. And if it goes on and on and on like this, it is really irritating. It impacts the quality of life, which is very disturbing, and it really can disrupt whether it's your work function or whether it's a child going to school who cannot concentrate, who cannot study. Though it's a trivial thing and we say, "Oh, don't worry, it's just allergic rhinitis, nasal allergies," it has a huge impact on your health. And I wonder if I can do a little signal for the next slide. So maybe a little wave. Would that work better, Dr. Manasa? Or would I say next slide? So as I was saying, the language that they're exchanging here, they must be arguing like crazy. It really impacts the quality of life. So the next slide. Yeah, you can do the next one. So I just want to talk about this young child. This is a 3-year-old whose grandmother told me that she was afraid to send him to school because he had constant colds. And she said, "I may have to send a maid behind him with a handkerchief." And that's very typical of allergic rhinitis. Although the children may not have you may not have recognized this. You think these children are getting constant infections. You're going to the doctor, he always has a cold, and maybe sometimes they're on repeated doses of antibiotics, but actually it's very, very early onset. A sign which tells you that this child has an allergic tendency, and this probably is allergic rhinitis. And some of these children could go on to have asthma as they grow older. The next slide, please. Okay, you can just, yeah. So this reminds me of another older patient. This is a 35-year-old IT professional who came with severe nasal problems. He says, I cannot sit in a Zoom call because I have to get up and wipe my nose, or I can't hear and I can't talk, and I'm sneezing and coughing all the time. And so this is very, very typical symptoms of allergic rhinitis, from mild symptoms to severe symptoms. So with the next slide, we can see some of the typical signs. We call this allergic salute, and you recognize people doing this, right? Sniffing and doing this. And in the next slide, you can see other features. What happens is you can see an allergic crease. If you look at the nose, the bridge of the nose, because of constant rubbing, you see a little line over there. You can also see dark circles under the eyes. And you can see little lines at the end of the eyelid, towards the nose. These are called Denny Morgan lines, very typical signs of allergies. And if the allergies, you try to rub your nose, you try to sniff, you try to make all these faces, and that is a telltale sign. And if these allergies are persistent and not treated, you have what you call very typical adenoid facies, where there's mouth breathing, snoring, and open mouth breathing. And there's facial deformities, and these children are sometimes with the adults with chronic rhinitis, they're always snoring at night. They have, what we call obstructive sleep apnea, so it disrupts sleep. And a lot of times you can also see the allergic eye conditions along with the allergic, rhinitis. So you can see redness, itchiness, especially this time with, the rains and the pollens. It really irritates the eyes. You feel like the patients feel like digging out and gouging out and scratching their eyes. It's very irritating. So with the next slide, what we can see is when you have allergic rhinitis, you may have other associated conditions, which we call comorbid conditions. When somebody has allergic rhinitis, a lot of these patients also have asthma. In fact, majority of the asthmatic patients also have allergic rhinitis, and many of the allergic rhinitis patients also have asthma. You also have a lot of associated, you're prone to upper respiratory infections, ear infections, allergic eye disease, and sinus infections. Nasal polyps is another condition that can occur. And I said it disrupts sleep. So the complications, other than the asthma, ear infections, sinusitis, they have loss of sense of smell, sleep disorders. You have something called as the allergic irritability syndrome, with all of this, getting so overwhelming, just impacting your day-to-day functioning. And in children, as I was saying, if we don't treat and recognize rhinitis earlier, you can lead to facial deformities, dental abnormality, crowding of teeth, and dentition issues. And it impacts their studies, their cognition, their functioning. So it really has huge impacts if this is not treated and recognized earlier. So with the next slide, we can see treatment. The best treatment is not recurrent antibiotics. The best treatment is to use a preventive nose spray, which we call, the topical nasal steroids. And even though these are steroids, it is not the kind of steroid which makes muscles or, impacts. It's just local. It's very safe and it works wonders. The other adjunctive treatment that we can use is, your standard neti. So in the US, somebody from India went there and then manufactured it big time. They call it the neti pot, but basically it's sinus rinsing. So how do you diagnose this? What tests? It's not the x-rays. It's not, any blood test, which is going to tell you, although your IgE may be elevated. But what is very important is to get allergy testing. So you can test for the allergens, and the skin testing is the best. And treatment, preventive treatment would be immunotherapy. So you build up your immunity to the allergen, and I will discuss this when I discuss asthma. So we'll move on to the next topic here. This is a 7-year-old child who had constant cough. She was said, her mother says when she ran at the dance class, she'd get out of breath, when she's doing this vigorous dancing. And she said, and it was worse during the cold season. Her symptoms would be worse. The mother herself had severe asthma. So I said, what do you do? Oh, I just give her a little puff of my, Astelin inhaler. And does it relieve? Yes, it relieves the child. So typically this child has asthma. If you look in the next signs as next slide, symptoms of asthma would be cough, persistent cough, if cough lasts for a long time, and you must think of asthma, okay? And sometimes you have difficulty breathing. And in young children, and especially teenagers, they're not able to express it very well. They have a kind of chest tightness, this perception of difficulty breathing. And if you can hit the next one, please. Especially if it's very severe, you have audible wheezing, difficulty breathing, that you need the nebulizer, you need to go to the hospital, you need to get emergency treatment. And it happens particularly during change of season, especially now we're seeing a lot of respiratory cases. And exercise makes it worse. It's not that exercise induced it, but because your lung functions is a little low, when you exercise, the respiratory reserves are not quite enough. So you do experience the symptoms, especially I asked children, everything is fine, they're doing fine. I said, okay, how do you do in sports? How do you do in gym? Oh my God, I'm not able to cope up with the other children. I find cough when I exercise. So that's a very, very important symptom also to diagnose asthma. Okay, so we will see with the next slide that people talk about asthma triggers, and this is a very, very old slide. It's one of my favorite slides. And yes, we talk about the pollution. One of the biggest things which trigger asthma is exposure to cigarette smoke, tobacco smoke. Viral respiratory infections can definitely trigger and set off the asthma attacks or the asthma exacerbations. Exercise, as I told you, is not really a trigger per se, but you perceive the asthma when you exercise, when your asthma is not under control. So if your asthma is not controlled properly, not enough medications, not correct medications, you will keep experiencing symptoms during exercise. We talk a lot about environmental changes. Yes, definitely it has a great impact on triggering asthma and leading to persistent asthma. Then the adults with asthma, if you're on a beta blocker for your blood pressure, like the metoprolol or some of the other medications, it could, aggravate the asthma. That's something to be careful and discuss with your doctors. People tell me a lot about weather changes. With this weather change in the cold air, in the AC, these are triggering my asthma. But it may be the ambient pollens which are, released when the weather is wet at that time. A lot of things about pets causing asthma and food additives. People always perceive that food is causing asthma, milk is causing asthma. Yes, maybe in some systems of medicine, they may say milk may aggravate asthma, but it's not the preservatives, it's not, it's not the additives, it's not the food, and probably not the milk. And we can discuss that. And I'm sure Dr. Manasa, Dr. Sandhya would give us more input on this because it's very important that we understand this. It's more likely allergens which are triggering, and that's majority of the cases, which we will see in the next slide. We can see that pollens, and we talk about parthenium, which you can see these little white flowers, but it's not so much the parthenium as the other little weeds, the spinach-like weeds, which you can see the middle two pictures. They look very much like spinach. We call these chenopods. These are the smaller weeds. You don't even see them. They bloom when the rain comes, and then they die out after some time when it's very, very hot. But grass pollen, as you can see, the first light green one, grass pollens are what are causing a lot of these allergies at this time of the year. It's not the trees with bloom, but it's these smaller pollens which are invisible. They depend on the air to pollinate, and they can travel very long distances. And in the US, we talk about ragweed, and you can see the pollens of these weeds look very mean looking. They release a lot of the allergens. And with the next button, we can see these are seasonal allergens, but what is very common is the indoor allergens, which has a great impact. Not only is it pet, but the biggest Uninvited pet is a dust mite. 80% of the allergens, 80% of the allergies, 90%, especially in urban population in the cities, is because of dust mite. And sometimes with the next one, we can see mold. You think mold is causing the problem, or it may be more the dust mites. Cockroach could also cause allergy. But pretty much, if you see in the next slide, we have changed our lifestyles. We live more indoors. We have upholstered furniture. We have all of these, fancy things to make our house look beautiful. And all of them are great sites for dust mites. They love to breed in this, especially the mattresses, the bedding, the comforters, the wool blankets, and your sofas. And you can see this looks like a really mean, nasty guy, the dust mite. It's invisible to the eye, but it causes a lot of allergies because they feed on the dry scales of the skin. And if we sit wherever we sit, the sofas and the beds especially, the older the mattress, the more dust mite and the skin human dander, which actually adds to about 10% of the weight of a mattress in a 10-year-old mattress. So that's the kind of impact this has, and we will talk about what to do in the houses. We can go to the next slide, please. So this is something I actually saw in one of the charts. One of my seniors, he had written, how do you control the environment? And the patient had a cat. The child was allergic to cat, and then they were not taking away the carpets. So he'd written in the chart out of frustration, kill the cat and rip the carpet. Of course, that's not practical. So I add to this, as a joke, do not breathe is what I also say. But again, let's look at what are environmental practical methods. So let's go to the next slide, next button. If you hit, I can show you here. So what do you do? So they say you can wash the cat. So I say gentle cycle only. But I want to be beware of the animal activists. Please don't jail me for making these statements. And if your child really wants a pet desperately, especially in an apartment where the pet is indoors, I suggest that, uh, I'm a pet lover. This is a rattlesnake or something else would be an equally appropriate pet to have. But jokes aside, let's look at practical environmental controls in the next slide, this is very important. So dust mite, as I said, is the number one culprit. So you can encase the pillows and mattresses. Please hit the next button, and I will show you what the mattress covers are. These are mattress encasings, and you have to make sure you get a proper brand because most of them are not the pores are not small enough to prevent the dust mite accessing. So encase the mattresses, and discussion, I can tell you what casings to have. You can wash anything that goes on the bed except the mattress, the pillow cover, the bed sheet, the bedspread, the blankets, everything should be washed once a week. And no wool blankets, no quilts, no fancy comforters. Just get some fleece blankets and layer, and then make sure it's washed once a week. Very important. And you can wet mop, the floor, wet mop with a rinsed wet cloth. You can wipe under the table, under the bed. It's very, very important. The sofas, it's good if you can get the Rexine or the so-called fall leather, the leather-like upholstery for the study chair, the dining chairs. Plastic or wooden chairs would be better, and the sofa especially, because if you focus on this, it's very important. Any chemical that is used, it's harmful to kill the mites. You see a lot advertised, you see a lot available. Once you Google them, you see dust mites. Amazon offers a whole lot, and none of them are good, and they're harmful actually. So pets, let me be very politically correct and say encourage eviction of the pet outside your bedroom, if possible. Wash cat contaminated items weekly and encase beddings. This also prevents pet dander from lingering on in the mattress and causing an issue in the pillow and the mattress. So mold control, you have to seal leaks and cracks. It's very important to have an annual AC service to replace the filter. Very, very important. And make sure the bathrooms are well ventilated. Okay, if it's dark and dingy and moist, then mold tends to grow. So cockroach, You have to make sure you eliminate food sources, no food in the kitchen, clean, spend an hour cleaning the stove, cover up everything, tie up garbage completely so that the cockroach comes to feed on food. So the stove you have to pay attention to, you have to take away the grease, wipe it, remove all the food debris, and control leaks. And especially in apartments, you get what is called as cockroach traps because it comes from the outside. So use those and they're useful. Very simple tip about natural pest, not pet, sorry. Cockroach is not my favorite pet. I hope it's not yours either. Natural control would be to use 1 part of boric acid, 1 part of atta, 1 part of milk, and 1 part of so milk, sugar, atta, and boric acid. So when you bind this, make it like a chapati dough, take little balls, put it everywhere in the kitchen, every shelf, every under the sink, in the bedrooms, under the beds, everywhere, and change it once a month. The atta is a binder, the milk is, and the sugar are to attract the cockroach because they like to eat that. And the boric acid, once they eat it, it swells up in the stomach and bursts. So it kills the cockroach. And if a child gets in or a pet gets into it by inadvertently, it's not toxic. So it's very, very useful to do this method of cockroach control. The next slide, please. So what about treating asthma? So what is this? Anybody identify this? This is actually datura. And the British, they saw the Indians smoking datura cigarettes. And all we can use to get rid of cockroach. Oh, cockroaches are allergic to everybody. Anyway, so what we can do is, so they used to, the British observed the Indians, army soldiers smoking these cigarettes. And datura is a bronchodilator. And they took it back to England and they started using it for asthma. So this is one of the first asthma treatment, which is a bronchodilator. And in the next slide, we can see there's been a whole lot of medications for asthma. We used to use tablets, theophylline, and then somebody observed that the cromolyn, so the tablets were very bitter. So someone in the manufacturing pharmaceutical industry, a child was taking these bitter tablets and pills, and she said, I wish I could just puff it. So that's how the inhalers, the puff, the asthma puff medication was evolved. And the inhaled steroids, that is the puff, the asthma medications, they have revolutionized the treatment of asthma. Again, these are not steroids which are bad for you. They're designed only to act in the lung and it's made very, very well. As you can see, there's a little box with a puffer and you get to put in the nebulizer also. If you've seen little children, they've used the nebulizer treatment of this administrating the inhaled steroid. And we've had some fantastic new medications. We have long-acting medicines. We have combinations of the bronchodilator and the inhaled steroid, and those medicines are wonderful. And it's really important. It's wonderful that newer medicines, the devices are very easy. I love them. They're breath actuated. So instead of huffing and puffing or using a spacer and trying to get the medicine, which is very, very difficult, you have some which are breath activated. So you put it in the mouth, one suck in, and the medicine comes out, and wow, it acts so fantastically. It's worked very, very well. Lot of new medicines, the tablets, the leukotriene modifiers were absolutely, absolutely useless. It's so widely used. I call it vitamin M. So the Montelukast, every pediatrician adds it and prescribes it, but they're really not useful at all. They have some side effects and we don't encourage the use anymore. New medicines, biologicals, injections, you block the allergen. A lot of new medicines have come, but I want you to see in the next point, we need to understand that you have relievers and you have controllers. The relievers are the bronchodilator. That's the Astelin. It can be used as needed, but you should not use it to treat asthma. You have to use the controllers. We used to tell you to use a reliever every single day, but now parents are smarter than us. They used to use it as needed. The combination of the bronchodilator and the inhaled steroid, or the combination, the duolin Astelin, the budesonide Astelin combination, or so now we have these device where you have the inhaled steroid and the long-acting beta agonist combination. And we have what is called smart therapy. So in milder asthmatics, it can be used as needed. Never use the bronchodilator alone. Never use the Astelin alone, because you tend to overuse it and it can cause a lot more harm. Especially when you need it, it doesn't control the inflammation. You can use the combination therapy, and we will discuss it in the question answer session if you have questions on this. So, how do you diagnose this? The best thing is to find out, of course, you can do lung, by history, you diagnose asthma. By lung function tests, you show that, there is affectation of the respiratory capacity because of the wheezing and all that. And then we can do allergy skin testing to see what is setting off the allergy. So preventive treatment is very, very important, that we do have immunotherapy where you build up your immunity against what you're allergic to. So you can get tiny, tiny doses and introduce the allergen literally. Earlier, it used to come as injections. You had to come every week if you were allergic to more than one thing. Imagine a couple of injections a week, couple, 2, 3 injections a week, every week, then monthly, then you had to come every month. Then it came as drops. Again, drops, you had to do the dose escalation weekly, monthly, and you had to come in for the every month for it, a course of 2 to 3 years, or around that. The best news now, whatever is available in the UK and the US, is now being imported into India. It has come as tablets. I'm very, very excited about it. It is working wonderfully. And the 80% of the allergens are due to dust mite. So now they're importing it. It's a tablet, the first tablet you take under the supervision of a specialist, obviously having proven that you are sensitive to dust mite. You can see a child over here. The right hand side, you can see the big one. Number 3 is dust mite, and number 1 you can see is what your body makes, histamine. That's my positive control, the one parallel to that, on the other side. But you can see how allergic this child is to the dust mite. And for the most part, in India, most of them are sensitive only to dust mite. The pollen allergies, even though you test it, many of them are not really that allergic. So, and they say by treating just to the dust mite, you could build up the immunity so that you build up the respiratory barrier and you're not as sensitive to the pollens. So this has worked really, really wonders, and it's dramatically changed the lives of asthmatics and patients with allergic rhinitis. So the next slide, please. So what are the risk factors? Is my child at risk? Am I at risk? You can do nothing about your genes. You're prone to developing allergies. You see it commonly in families. A child is doomed to be allergic because in order to preserve the fetus, the infant, to preserve and carry the pregnancy, you have to create this, what we call the Th2 kind of a milieu, an atmosphere, the allergenic kind of a atmosphere to protect the fetus from being rejected. And there are some things which protect, there are some things which make it worse. So when you, after birth, things even before birth and after birth, factors which make you allergy prone is exposure to tobacco smoke. It's a huge, huge one. Pollutants also, yes. Indoor allergens. Indoor allergens can really skew you towards having persistent allergies, asthma. Okay. And that's something we need to learn how to control, and something can introduce immunotherapy very early to prevent the development of allergic disease, to prevent the atopic march, to prevent the progress. It's something which has really, really impacted the allergic disease. The other thing is lifestyle changes, obesity, diet, gut health, probiotics, activity, all of these, which are very, very important in modifying the allergic response. We talked about endotoxin. That is what you're exposed to, different infections. And children who grew up in farms have a better immunity, do not develop allergies. They did a huge study in Germany compared to children who are growing up in cities, children who are eating processed food, not exposed naturally to natural, healthy loads of bacteria and endotoxin. Infections, Respiratory viral infections, early antibiotic use also precludes you towards developing atopic disease. And the next slide, we can take a look and see. This is very well illustrated. When they found that infectious disease were under control, especially after introduction of penicillin and the vaccines, asthma started completely, increasing. It was very, very interesting to see this. So they brought about this hygiene hypothesis concept, and we will see in the next slide that allergy and asthma is less common in rural areas compared to the urban areas. And urbanizations has its plus points, but as far as asthma and allergic disease, it really has, huge negative impact. So something we have to think about, and we can go to the next slide, please. Oh, the next slide is blank. So yes, to, reiterate, and you can just click the next few things very rapidly. Obesity, little champ over here who's rewarded by his parents. If you eat this, I will give you ice cream. So we do this negative reward. And the other thing, if you click stress and poor parenting under stressful condition also favors the development of allergic disease and atopy. A lot to think about. So we can go to the next slide. So I want to kind of focus on the next few slides very briefly. This is a 15-year-old asthmatic who had a birthday at school, ate cake and samosa, had immediate allergy with rapid progression of urticaria, the rash, the swelling of the eyes and lip and face, wheezing, difficulty breathing, throat tightening, vomiting, hypotension, total collapse. She was rushed to the hospital. He was rushed to the hospital. And unfortunately, the child, he was given antihistamines and, IV fluids and steroids, but the child died. And the child was known to be egg allergic. The mother had gone to a local bakery and he said the cake was eggless. She took the cake in. Unfortunately, egg was a hidden ingredient in the cake powder. They put egg powder in it, and very, very unfortunate. So the next slide, we can see this is what food allergies. You can have allergies to egg and milk and, in childhood, and in the adults, it's more peanuts and tree nuts and seafood and shrimp. And in the next slide, we can see that what I described as anaphylaxis, like the peanut allergy that you hear about, where you have this multi-system, severe progressive allergic response. So when we do in the next slide, what we see is the treatment for that is an emergency. You give adrenaline. In the US, you get EpiPen, which is injectable. Now we have nasal adrenaline. You just have to squirt in, which we're trying to see if they can import that into India, working on that. And this is an extreme example of food allergy. It is an IgE mediated immediate response severe food allergic reaction. We have to distinguish this because people associate food, peanut, severe allergy. Oh my God, I'm going to die. I have a major problem. But it may not be this kind of an allergic response. We go to the next slide, please. So when we talk about allergy, you have your IgE mediated immediate responses where we have this multi-system skin, urticaria, rash, swelling, respiratory, systemic response, anaphylaxis. Or you could have, a middle kind of a reaction, the atopic dermatitis, the eczema. And then you could have some of the other gastrointestinal to the far right bottom. You have enterocolitis, enteropathy with vomiting, with bloating and all that. You also have something called the eosinophilic gastrointestinal disorders, where you have pain. Children have loss of appetite, abdominal pain, reflux-like symptoms. Teenagers have kind of difficulty swallowing. And the older patients have difficulty swallowing and heartburn. And we can see in the next slide, I'll briefly go over a couple of cases. So clinical spectrum, we can just go on to the next slide, please. You have this child with eczema. In children less than 5, it's probably due to a food allergy. And in adults, I was saying it's not due to food allergy, different reasons. Next slide, please. And you can also have young children with the colic and crying. This is a 1-month-old child who had constant crying, poor weight gain. He was found to be milk intolerant, and once milk was eliminated, he did okay, and we were able to reintroduce milk afterwards. So the next slide, I've left blank. And I'm going to kind of, if you quickly click the next few things, nothing against any brand. I love Lay's chips, but these dudes are telling you that it's made with real fruit and real flavor, but really it's a lot of coloring agents and processing and all, which we will discuss with your cases. I think I will just end with this and open it up for discussion, because food allergies, there's a lot to discuss, and I'm sure you have a lot of questions also.
Thank you so much, ma'am, for such a nice, quick, and practical solutions for most of the things which are commonly faced by most of the people. So we have quite a lot of questions, which we will take one after the other. Somebody has raised their hand. You can just unmute yourself and ask, please. 1 plus CPH.
Yes, thank you for the enlightening discussion. I'm Dr. Anuradha, and I had a question. How do you explain adult onset allergies? Like, I know a lot of people who had, milk products and gluten products all their life, and then post 40 or post 50, they say they are gluten intolerant or they've been
Okay.
diagnosed with lactose intolerant.
Okay, so that's a very, very important question. I'm so glad you asked that question. When we see food allergies, we have to distinguish it from the IgE, the immediate reactions like the peanut allergy, anaphylaxis, or maybe a little bit of a rash or anything. So if you eat a peanut, if you're milk allergic or egg allergic, I have a lot of patients who have egg allergies, a lot of patients who have shrimp allergy, especially a lot, as soon as they eat it, they get a rash. As soon as they eat it, they may have wheezing. So that's an immediate response, and it happens every single time. It's not a delayed response. Some of the other gastrointestinal problems are delayed responses. Gluten sensitivity is something totally different. Gluten sensitivity is intolerance to gluten. So if you have gluten products like the wheat and the bread and all that, it actually damages the lining of intestines, and over time it results in blunting of your intestinal villi. The villi are what absorb the food, and so once that is blunted and flattened, the gluten acts like a toxin, in the sense it causes delayed reactions. It causes symptoms of bloating. It may have abdominal pain. And the treatment for this is to eliminate gluten from the diet. So you can do blood tests like a trans tissue glutaminase testing. You can look at the IgA. The best thing is to do endoscopy and actually see what there is, get an endoscopy, which is a very, very simple procedure now. It's not as complex as what you think with a skilled gastroenterologist. You have to have a diagnosis and then you eliminate gluten. That's food intolerance. That is not food allergy. Okay, very important to distinguish this. A lot of times I have adults now, they may be intolerant. They come with a whole list of, things that they're intolerant to. And they're desperately trying to find the reason for their symptoms. So, you think it's this, you think it's that. So that is not an IgE mediated reaction. Sometimes I do the testing to tell them, this is not, you're not going to have a severe reaction. This is not what it is. Let's try and eliminate all of this. Maybe you need to see a gastroenterologist, get an endoscopy, see what's going on in there. And then you start reintroducing one after the other. We do have an entity called food protein induced enterocolitis syndrome. We used to see a lot of it in children. It used to be due to milk. I've seen patients with vegetable and fruit. Very, very rare. I've got about 3 or 4 patients in all these years. So these patients have abdominal pain and then irritability, crying. So they find that in these patients, they have delayed vomiting. They have very, very profuse, severe vomiting, and they can collapse. They can become hypotensive, they can collapse. And once you eliminate that, they do well. And then you can slowly start reintroducing these patients and they grow out of it. We are seeing now an adult kind of a food protein induced enterocolitis syndrome. So some of these patients may need to be evaluated for it. And it's difficult to find the diagnosis. We have to really play detective and try and identify it. But for the most part, when people talk about gluten intolerance, I find it's just constipation, it's lack of fiber. And it's very important to redo their diets. And it's surprising how horrible the food we have that is available and the kind of food that we eat. It's because it's so processed. Even the rice that we eat is processed, it's got no fiber. The wheat that we eat is processed, it's got no fiber. And we need to rethink about looking into diet and addressing that issue. We have to sort out this issue from a food allergy. And lactose intolerance, yes, lactose intolerance, if you have a deficiency of lactase enzyme, you will not tolerate milk, and that's quite prevalent. So that also you can diagnose. I think you need to get a diagnosis before you start eliminating food or doing things with your food, because then it makes it a lot more easy. If it is a true lactose intolerance, then it's easy to treat. If it is something which can be changed by dietary modification, even better, right? When there's no basic disease condition. So we need to address these case by case.
Okay, we had
I see a question here, continuous sneezing during early morning, mid-evening. I think you all can tell me the diagnosis. If it's continuous sneezing, especially early morning and mid-evening, it's probably allergic rhinitis. If it's probably dust mite allergy. Precautionary measure, no, you have to treat. You have to, have a doctor examine you. You'll have pale nasal mucosa and it's swollen and boggy. And treatment would be you can just try an antihistamine and see if it helps. But taking antihistamines every day is like taking paracetamol every day for a fever and not finding out the cause. So topical nasal steroid like a nose spray, it's important. That will really take care of the symptoms. You can see a doctor and request it, let them take a look at it. But to do allergy testing to find out what you're allergic to would be very, very, very useful, because then you can address what is mainly causing the issue. Because it's continuously sneezing, it is so disruptive, it's so tiring. You can't think, you can't, it affects your breathing, you can't, it's just very difficult. It may seem simple, but it needs to be addressed and treated. And then something
before
about,
that, I have
yeah,
a few
sure,
questions which are on the
yeah,
other window. So,
sure.
can menopause trigger food allergies or food intolerance?
I will leave food intolerance separately. Menopause will not trigger food allergies. It's the allergen which triggers allergies. You usually, if it's an IgE mediated allergy, usually it occurs much earlier. Yes, menopause can cause hormonal changes and different issues which could impact your digestion and your tolerance for food. And especially, I think with menopause, weight gain happens, and that leads to inflammation. And whenever there is inflammation, it does impact issues with digestion and food processing. So it doesn't trigger allergies per se. So I think with addressing the other issues with the weight gain and making diet and lifestyle changes, it should help in treating and addressing that issue. And then if you say, does menopause cause food allergies, then you have to go back to the history and see, is it a particular food? It cannot be a whole lot of foods.
I
Okay.
think the question was from probably intolerance perspective because
Yeah.
many experience a lot of bloating, acidity, and
Yes.
gastritis
Yes.
kind of symptoms.
Yes. Yes.
So, moving on to the
Yes.
next question, when you are exposed to chlorinated water during swimming, would it cause any adverse effect on breathing?
Yes, that's a very important question because chlorine is an irritant. So any strong irritants could trigger an untreated or undertreated rhinitis or asthma. Strong
So,
odors, strong irritants, strong chemicals that you use to clean your house, bathroom cleaners, pretty strong bleach. Yes, it could trigger. And the other thing is, if it's very, very strong, sometimes I've seen there's something called, is it a one-time thing? Is it recurrently when you go to the pool? Probably it's a
it's a
recurrent thing.
question. Yeah.
Yeah.
Recurrent.
And then, yes, certainly, yes, it could trigger, an irritant response and it could make the allergies worse. And if you have asthma, it could certainly set off the asthma also. If the asthma is not treated properly with the anti-inflammatory. agents.
So
So
you
we like
have
to treat the asthma to the point that these irritants don't irritate you. Trigger should not trigger your asthma. So that's the level of asthma control that we say your asthma is controlled. Because asthma is a on and off phenomena. It's not every day. So the best asthma control you like to achieve is not only your daytime symptoms, your nighttime symptoms, your exercise symptoms, but trigger should not suddenly trigger and cause an asthma flare.
So do you have any tips for children who are prone for recurrent bronchitis or these bouts of
Okay.
breathing who go for swimming?
Okay, thank you for that question. I don't believe in the word recurrent bronchitis. I
Okay.
think you have to make a diagnosis. Is it asthma? Is it not asthma? So you need to, if it's an older child, do lung function tests. You need to go by the clinical history and diagnose it. And recurrent bronchitis should not be recurrent bronchitis. Okay, it should not be, because a bronchitis is an infection. It's a one-time thing. But if it's recurrent bronchitis, it's asthma that needs to be addressed, that needs to be treated with an anti-inflammatory. Need to find out the triggers to initiate preventive treatment. And thank you. That's a very, very important point, because most of the time asthma is not called because people don't want to hear the word asthma. When I write asthma, I see patients panicking. I see tears in their eyes because nobody wants to name it. I say, no, we have to call it the proper name, otherwise you'll not get the proper treatment. There's nothing to worry about it. We can treat it and we can even prevent it and give preventive treatment.
Can cats induce asthma?
Oh, cats are one of the most notorious allergens. In fact, when I was putting the slides together, I saw a cat playing in the grass. It was a cute little picture. Definitely, yes. A lot of patients are cat sensitive, especially when they live in apartments and you are exposed to the cat. Cat allergen is very, very highly sensitizing. And the moment they touch the cat also, or they go into the room where there's a cat, go to a friend's house who has a cat, you can induce a sneezing. You could also trigger asthma. Definitely the answer is yes.
Okay. Can eating berries cause breathing problems?
Eating berries will not cause breathing problems, generally, unless you are specifically allergic to any one, like a strawberry allergy. It will not cause breathing problems. If you have a food allergy and you have symptoms of breathing difficulties every time you have it, it may be a symptom of anaphylaxis or more severe allergic reaction. But if you just have asthma and you feel the berries are causing the asthma and it's not like a rash and the severe wheezing immediately, I don't think the berries cause asthma per se. But the problem is a lot of the berries, they have preservatives in them. A lot of them are sprayed with chemicals, so that could cause some kind of a reaction. So we need to be a little careful and we need to sort it out.
Okay. Can you tell about the Montelukast, which you said is not so great to use? And also, can you talk a little bit about drug allergies?
Sure. So Montelukast is something which we thought would be the best thing that's happening in asthma, because it was non-steroid, because people didn't want to use steroids. And it came as a tablet form. You didn't have to puff, you didn't need needles. And we were looking forward to it because this is a problem. When they do drug research, it's done on animal models. And in the animal models, you can always go to a very high dose, right? The very high dose works wonders. But the problem is the very high doses also have toxicity. So when it actually comes as tablets for human use, there will be side effects. So it's toned down to an acceptable dose. So the earlier leukotriene modifiers worked very, very well, but then it had liver side effects and all. So they kind of stepped down to the safe leukotriene modifier, the Montelukast. And I don't think it made any difference. Okay, because if you really look scientifically, the responders are very few. There are very few patients who actually respond to it. I had one patient who was on oral steroids. This was this wonderful responder. 25% of the patients do not even respond. This patient did very, very well, and that's just the one patient. I think what has been working is because the Montelukast is combined with an antihistamine. So you have the Montelukast with the cetirizine. You have fantastic permutation combination. You name any leukotriene, any antihistamine, you have FX, you have C, you have LC, you have all sorts of things. I think it's the antihistamine which was working. And antihistamine should not be used every day. You need to go to preventive medicine. So they have found that they feel that Montelukast also caused some psychiatric disturbances, etc., etc. My thing is this, I joke about it. I said, because it didn't do anything, the patients are so frustrated they may have had psychiatric disturbances. So it's not something which works. It's been used very, very widely because it's been marketed as a safe non-steroid tablet, a liquid or a syrup or a tablet which people like to use, especially in India. They relate more, they like to use tablets and syrups rather than the puffer. Because in the old Indian movies, somebody will be coughing as they're dying. You use a puffer. My grandmother refused to use an inhaler because she felt if she uses the inhaler, she'll die. So there is this barrier for using inhalers.
I think that's a very important point you brought up, Sujata, because a lot of people, because in our country it's available over the counter, automatically, they are just popping in Montelukast by the dozen, especially in the allergic, the seasons which are predisposing to allergies. So it's just bought off the counter and used. So I think that's an important message today for everyone listening in, to use it with caution or not at all, really.
Go use it appropriately. Don't use it inappropriately as it's being done now. And a lot of pediatricians just I call it, like I said, vitamin M. Oh, so you're on this, and this, and oh, vitamin M also, right? Oh, what is vitamin M? I said, okay, the Montelukast. And the cough syrups don't work either. You should not be using cough syrups. You should not be using antihistamine syrups. Okay, I have a lot of patients, some of them come from the rural area. Siraf kotru madam, siraf kotbidi madam. After all the explanation, they want the syrup. So we need to change that mindset. Because treating asthma rhinitis is very, very simple. Sometimes I'm like, what am I doing? I'm just writing one medicine, It's so simple.
So we will come back for the histamines. Can you throw some light on drug allergy?
Sure. So drug allergies, again, the commonest drug allergy which we see, especially in females, would be your NSAID allergy. That is your aspirin, pain medication, painkiller, the ibuprofen, the ibugesic, the diclofenac medicines. So when we talk about a drug allergy, we talk about an IgE mediated drug allergy. That is, you take it, you get an immediate rash. You take it, you may have a severe anaphylactic reaction. So that's the reference and the context of drug allergy. Very commonly seen in India a lot with the non-steroidal. And it may be just, with taking the tablet for body pain, a lot of it is disguised in cough, cold, sinus remedies. If you take any of these over the counter, it invariably has a non-steroidal. I had a patient, this is a wife of some minister, and this person was on a whole lot of medicine. She was on, anti-diabetic medicines or antihypertensive. She was on, for hyperlipidemia, two of one, two of the other, one of the other, her fourth food group was protein, carbohydrate, fats, and medicines, big bag of medicines. And one day she took something, she was brought in with anaphylaxis. She almost died. She had wheeze, rash, collapse, no BP. And then we looked, she had a whole lot of medicines, which were her usual medications. And then I said, okay, is there anything else? Anything else? What's going on over here? And they told me that she had a cold and she went to a GP and then it didn't get better. So she went to one more GP, was prescribed this cough, cold, sinus remedy, which had a non-steroidal. It had diclofenac in it. So she was anaphylactic to this diclofenac as a hidden ingredient. Okay, so that is your true drug allergy. We see this with antibiotics. Sometimes you can see it with anesthetic, general anesthesia. We've had, consultations where suddenly the patient has had a reaction. So these are acute reactions. You have side effect of drugs. Like if you get irritated, if you take you may have diarrhea if you take augmentin or an antibiotic, or you may have heartburn or burning if you take some other medicines. These are side effects. These are known side effects of the medicines. Or if you take, something to treat your asthma, you may have tremors, with some of the bronchodilator puffers. So see, these are known side effect, pharmacological effects of these medications.
So
People think that the drug caused a rash. The drug caused my skin problem. The drug caused my food problem. The drug caused my digestive problem. I think we need to sort that issue out and sort out your true drug allergies from what you think may be causing allergies and try and find out what is causing your allergy.
Okay. So my daughter uses inhalers only around January when the weather shifts. She uses it for dust allergies because of dry leaf shedding. Will she be addicted to inhalers all the time?
So I think this is a very, very important question. Thank you so much for asking it. If she has inhalers only around January, what happens? She probably has dust mite allergy. Probably in the cold season, you tend to use your blankets. Otherwise, it should happen in December. Maybe when the weather changes. See, there's a lot of viruses. Though December is very cold, the pollens, it freezes. There's no pollens, and for the most part, and then you tend to have the viruses coming in at that time. So it could be viral infections triggering it. It could be dust mite. And I'm not sure dry leaf shedding. I'm not sure. I don't think it's mold because mold is a perennial allergen. But the bottom line is during the cold weather, she tends to have exacerbation. So she is using her inhaler. So if she need to use the inhaler, she is symptomatic. My question would be when she runs on a normal day-to-day basis, does she get out of breath? Number one. Is it only nasal symptoms or is it nasal and chest symptoms? She probably would need to get a lung function test. So you get pulmonary function test. You need to get pre and post bronchodilator because even though the baseline is normal, you have to see if there is improvement with giving the bronchodilator. That will tell you how much inflammation there is in the lungs. We also do something called a pheno, which looks at the inflammation. Basically, it measures the amount of nitric oxide in a breath. But the pulmonary function test would be very, very useful to do, especially the time when she is symptomatic. And then, depending on the test results, you could also do skin testing to see what is setting it off in January, what is triggering it would be very useful to do. Okay. And I think it's dust mite. And then, if you need to use the inhaler, you should use the inhaler. It depends on how severe is her breathlessness. So, obviously, if she needs the inhaler, what kind of an inhaler? Is it just the Astelin? Is it just a bronchodilator? Or is it a combination? Is it an inhaled steroid? And if you're using the inhaler, you should never use a beta agonist alone. Yes, you use it for emergency, but you don't use it on a regular basis. You could use a combination of a beta agonist and a long-acting inhaled steroid. That would be very useful, but I don't think she will get addicted. When you need it, you use it. If you have symptoms and you don't treat it, you would be causing a lot more problems, a lot more discomfort. And what these inhalers do, it controls the inflammation. So if you don't control the inflammation, you actually lead to a lot more scarring. Okay, so that is very important. You will not cause addiction. It's not a question of addiction, it's a question of how much medicine does she need. Does she need the medicine? If she needs the medicine, you have to give the medicine. But I think it's more important that you do lung function tests, you get tested, find out what is triggering it, and then address the issue. It will help. And there's nothing to be afraid of. It's very easy to treat. We have wonderful preventive medicines. And once you treat it, the impact on the quality of life, on breathing, running, playing, doing things, it really has a huge impact.
So sleeping directly under the fan causes sinus issue, and exposure to cold air also causes the sinus. What
Yeah,
should we do for
especially we
that?
see it at this time of the year. A lot of my patients, they come into the hospital and I feel bad for them because it sets off their nasal symptoms. It tells you there is inflammation. So if it's happening on a day-to-day basis, you need to be evaluated for allergic rhinitis, tested, and then treated for it. It would help.
So, addition to that, if someone has allergic rhinitis, like the bouts of sneezing and the cold, what kind of test they should be doing? What allergy test they
So
should?
I'm glad you asked that question. Thank you so much for asking it because there's a whole lot of allergy tests. You have blood tests, you have panels, you have, 108 tests that you could get when you do the blood test, but most of these are non-standardized. The companies which do them, uh, it could be misleading because they test to antibiotics, they test to chemicals, they test to food. Food allergy testing is absolutely not indicated for evaluation of allergic rhinitis or asthma. And these tests are very expensive. It runs up to 18,000 to 45,000 rupees. You have fancier tests which looks at which component of the allergen you're allergic to. So I usually do not do any blood tests for evaluating allergies. That is the nasal and the lung allergies. And certainly not panels. Panels are not at all indicated. Okay, because these will tell you little, low, mid, high. All of us make IG to everything. So if it's low, it is completely not significant. But they compute all these results and you have the red color, green, red, orange, very red color. So it causes more confusion. So probably the skin allergy testing would be very useful because you can immediately identify what the problem is with standard allergens.
And
Allergy skin
many
testing.
hear from their pediatricians at times that if you have another option other than Bangalore, you can move for a better respiratory
Oh,
health of your child. So,
no.
is Bangalore weather or pollution, what is responsible for more
I
incidences of
think earlier it may have been Bangalore, but I think we're seeing a lot of allergies all over. You see it in Chennai, you see it in Kerala. I had patients who earlier would tell me, oh, the moment we go to Hosur, it's fine. The moment we hit, Kerala border, my allergies are gone. It used to be thought of as Parthenium and all that. I don't think we see that kind of a profile anymore. So I think it's important to again do allergy testing, find out what you're allergic to and address that basically. Don't move out of Bangalore. It's polluted, it's horrible, it's crazy, but it's still a wonderful city to live in.
Okay, thank you for that.
Yeah.
And does nasal hair has any role in preventing rhinitis or asthma or
Sorry, nasal what?
hair in the nose?
Nasal hair. I mean, are you talking about? I'm thinking of an old uncle of mine who'd have a lot of long hair in the
Yeah,
nose
I
and
mean,
growing out of
probably
the
from
ears.
that
Okay.
person.
Are we referring to that kind of nasal hair?
Probably.
Or nowadays you don't know what these children do. Okay. They have ear piercing, nose piercing, belly button piercing, eyebrow piercing. I don't know if they start hair transplant in the nose. Okay. I don't know, but I don't think so. I don't
Okay.
think it causes allergies.
Okay. So, I mean, one person is waiting to ask a question about histamine. Before that, what's your take on pranayama and other things to improve?
So thank you for asking that question because I think it's very, very important adjunctive therapy, which absolutely helps. Okay. Because a lot of children I find have disordered breathing. They don't even know how to breathe. They're so stressed out. If you tell them to take a deep breath, I can't hear anything. And then I say, oh, do I have to send you to the surgeon, to see if you have lungs? They just have forgotten how to breathe. And then I have to lay them down and show them how to do proper breathing. So definitely it helps a lot for the asthma, number one. Number two, sinuses. You have to aerate your sinuses. So any air that goes in is first warmed up and then moisturized, and then some of the big particles you get rid of because the sinuses are lined with cilia and they actually move the particles up and out and they actually drain out the mucus and all that. So pranayama is a wonderful adjunctive. But parents force their children and you have to teach them correctly. So if you tell them to breathe, I mean, these patients, they're doing breathe out, breathe in, take the medicine. I said, you're doing Kapalabhati, you're getting no medicine in. So I think it has to be supervised and taught
Yeah,
properly
definitely it
also.
has to be done under
Yeah,
supervision, and every
absolutely.
pranayama is not for everyone.
Absolutely. Yeah.
So we moving to the next question. Dr. Jayashree, would you like to ask your question directly?
Good evening, Dr. Sujata. It was a very nice talk. I'm Dr. Jayashree. I'm a former professor and head of microbiology and immunology at Kidwai
Wonderful.
Campus.
Okay.
What is your take on histamine intolerance because in India? Because
Okay.
what most gastroenterologists here do is they poo-poo it, whereas the West writes so much about it. They diagnose, and they also have treatment in the form of diamine oxidase, which is not available here.
I'm sorry, the latter half of your question, who diagnoses it? Where is it diagnosed and treated?
In the West, in the
In the
West,
West.
yes.
Okay. Okay. So, okay, thank you. So, in the alternative system of medicine, so I'm going to talk to you as a board certified allergy immunologist practicing in the US also, trained by the best of the allergists. So, in our system, as we have studied it, we do not subscribe to this concept, because there are some people, I know there's somebody in Goa who does this, where they talk about histamine intolerance, they talk about a lot of these intolerances, and they say, how is this diagnosed, may I ask?
No, no, that is the issue. So nobody, it is me myself. I have this issue. Spinach, brinjal, walnuts, cashews,
Ah,
tomato. Oh no, I'm fed up.
okay,
So
so fine. So I think we have to specifically discuss your case. Okay. So if you have brinjal and cashew nuts, what are your symptoms?
I
If it's okay for me to discuss
No,
your case.
maybe she can
Yeah.
visit you, Sujata. I
I
think
probably
that's
that may be better, because let me
yeah.
just say something, because brinjal is a natural histamine releaser.
the
Okay.
inducer, correct. All
Okay, but I think we should discuss your case, because it's very different, and it may cause confusion if we'd have to go
Definitely.
very much in detail and talk
Yeah,
about it.
She's
I
going
will
to visit you.
definitely comment on you.
Yeah, yeah. Bobby, I think, this topic has generated so much of interest, and it's been so important to discuss these things. Sujata, we've been talking about this. Once a month, we need you to do an OPD in Pramea.
Well, we will try, definitely. If Dr. Sandhya, can you fly me in your private jet? I would love to do that. But jokes aside, one question I saw over here: hair dyeing leads to
Yeah, I mean,
allergies
I
like
have
what?
little bit addition to that.
Yeah,
Hair dyeing and or hair coloring, will it
yeah.
cause any skin allergies or cold or
Absolutely,
rhinitis?
absolutely. You have hair dye. Hair dyes have paramino benzoic acid. It also has, sorry, paraphenylene diamine, and it's got a whole lot. Those chemicals definitely cause cold, sneezing, and all that. And especially they notice it after they have their hair dye. And if you see when they wash the hair dye off, you see blackness over here. Suddenly you see people looking like Lord Krishna. It's the Kalamega Varnam. They become dark. You look at some of these news reporters, you look at a lot of people, your own friend circle, you see this blackish coloration, black face. And yes, hair dye can cause skin pigmentation. Hair dyes can cause severe allergies, sneezing, coughing. Hair dye can cause contact sensitivity. Hair dye can also cause eye swelling, nose swelling, lip swelling. I've seen acute allergic responses. It's because any hair dye, natural, unnatural, organic, any hair dye, because they say, oh, ma'am, what can I do? The color doesn't come. So I mix a little Godrej, I mix a little hair dye. I've tried natural hair dyes. I've tried so many things. The product starts good, but invariably, because people want the darker color, they add in this. So absolutely yes. The answer is yes. You got to be careful about hair dyes.
We had few questions where common things like, when I eat that particular food, I get skin itching, or why certain food triggers allergy and acidity, or why certain, uh, I mean, some category of food gives them certain discomfort,
Okay, so I
and
think
particularly oil.
sure, sure. Very, very, very important question. Thank you so much for asking that, because this is something we commonly come across, and it's not just commonly come across. Everybody is uncomfortable. The food that you eat is making you so uncomfortable, causing all these symptoms. It causes, gosh, when I see patients with food allergy, I empathize, because you're thinking so much about it. It becomes a mental issue. Not that you're mental, but it becomes such a huge burden. And I find that, yes, the oils can irritate. Oh gosh, I don't know how to explain this. So, a lot of food in India, unfortunately, has so many chemicals and preservatives. that may be causing a lot of symptoms. A lot of fruit, we think you're buying papayas, and I'm like, I shudder when I see picking up 3, 4 big fat papayas. Papayas are bigger than all our heads put together, and they're artificially ripened, and that can actually cause a lot of allergies. You're introducing so many toxins in your body, and yes, a lot of these additives, a lot of the processing can cause problems. So patients ask me, what can I eat? And that's a whole discussion. Yes, I understand it's a difficult issue. We have to again sort it out between what is a IG mediated true allergy from food intolerance. That falls into the domain of food intolerance, which is a huge chapter, which is very complicated and very difficult to analyze.
Yeah, and also I think the purpose of this community really is for us all to put our heads together, think how we can reduce, adulteration, reduce our intake of processed foods, etc. So, I mean, in more and more sessions, we can discuss those kind of things, I suppose.
Just one last question for the session. When someone experiences skin allergy due to hair color, what should be their immediate response, or can it be treated?
Okay, I have a lot of patients who come with this problem. Unfortunately, you have to stop the hair dye. And unfortunately, there used to be a few products which were very good. Okay. And they're putting dye in those products also. And the thing is, you can use indigo and henna. You do the henna first and then the indigo, but you have to get the leaves and grind it and put it on yourself, because even that is contaminated. So if you can source something, and somebody told me some other product, I can look up and tell you. I've not tried it personally, but just give me 1 minute, because this is a problem. A lot of people,
Yeah,
ask
particularly a
this.
lot of women want to die, particularly after their treatment for major
I
illness.
understand. Okay. You feel like, yes, I look better, I feel better. So let me just tell you, I don't know this product. Somebody told me, oops, sorry. Some product they told me, because everything else I find is being contaminated now. In fact, I had somebody making it,
Yeah.
and she
Meanwhile,
promised everything, but they're contaminated. So anyway, if I can
what to be done for the skin discoloration that happens?
see the skin discoloration, there's nothing you can do. I think the best thing to do is to not do anything, stop the dye, and over a period of about 6 to 8 months to almost a year, you can slowly see the pigmentation go away. Okay, so I always, when I present cases, I say, okay, patient A, black face, patient B, black face. And then after some time, the black face became white. Okay, so it takes time, and it will go away. But it really, really takes a long time. So don't do anything else, dermatologically. People may have a lot of solutions. I don't know the answer, but my best advice is be patient.
Thank you for the wonderful input. Sandhya ma'am, do you want to put the
Yeah,
conclusion?
yeah. So I think, we're almost at 9:25. Yeah, that's a long question and answer session. Thank you once again, Dr. Sujata. It was absolutely marvelous that, you covered so many things which are really important. I think you brought in the importance of recognizing childhood, what is rhinitis and allergies in childhood, and the difference between that and asthma, how to recognize asthma early so that we don't, miss out on proper treatment, labeling it as something else. Very importantly, I think that is a message to all our people. Don't be afraid of the diagnosis, because the solution is simple. And I think that was a very important point. Lots of lovely things were discussed, and I'm sure everybody found it very useful. There would be a lot more questions, maybe,
Sure.
but we can take it up in our WhatsApp group, forward it to you, and we'd love
Sure.
you to be part of
Absolutely.
the Pranasakhi
Absolutely.
community, so we'll add you to that as well.
Love to. Thank you.
Thank you so much for your valuable time, especially on a Friday evening. I know it must be really busy, but thank you so much.
Thank you very, very much. My pleasure.
Thank you.
Thank you so much, ma'am, for a wonderful presentation and explained with such a beautiful examples and the expression what the patient experiences as well. It was quite engaging and nice. And thank you everyone for participating and asking so many questions. If you feel you have to ask more, please write it in the group. We shall send it to the expert and we will get it addressed. Thank you all. We shall see you on 7th of August with another interesting topic. Till then, please take care of your health. Thank you. Good night.
Thank you. Good night.